You seeing my screen?
I am
Stacey?
seeing your
Awesome.
screen right
Fantastic.
now.
A seamless handoff. Seamless
I
handoff.
love it.
Yeah.
So, Dr.
Awesome.
Richmond is the founder and CEO of Flourishing Phoenix Veterinary Consultants, and he's the practicing medical director of a hospital in Florida. Passionate about positive culture, psychological health, safety, and well-being in veterinary workspaces. He works towards implementing tools and policies for thriving and flourishing in the profession, especially at our critical education and career points. Dr. Richmond is currently serving as chair for both the Florida Veterinary Medical Association's Outreach and Professional Wellness and Wellbeing Committees, and he's a member and advisor of several national committees for workplace suicide prevention and veterinary well-being. We're so excited to have you here, Dr. Richmond. So on that note, I'll pass it over to you and we'll go ahead and get started.
Awesome. Thank you, Stacey. Thank you everyone for being here, and really very grateful to Fear Free for having me tonight. So I want to take you back to 2020. We all remember it. So just kind of imagine yourself, it's 2020, it's May, it's Florida, it's hot. CSR comes back. We've got an emergency en route. 6-month-old puppy collapsed in the backyard. ETA 5 minutes. So we've all had that happen in our veterinary hospitals. Now, we're gonna start off with a little bit of a choose your own adventure. So you have an option, and just go ahead and put it in the chat. You've got 2 clinics. You've got one clinic where you've got a medical director, a veterinarian who's there. Veterinarian is, very, very authoritarian. It's my way or the highway. New and fresh in this clinic, and there's just a feeling of just kind of butting heads. There's some toxicity, there's some disagreements publicly. It doesn't have a good, necessarily a great feel to it. So that's clinic 1. Clinic 2 is a clinic where the medical leadership at the team. So you've got the leadership works as the medical director, the practice manager, the lead CSR, the lead technician. Everybody works together. Huge amount of empowering the staff, a lot of laughter. Mistakes are looked at as a systems issue, is what can we learn from this? Where can we grow? So if you would, we just had that emergency call. Which clinic, just put it in the chat, which clinic would you like your dog to go to? 1 or 2? Crystal, two exclamation points. Clinic 2. Kate, yep, 2, yo, yep. Awesome. We got, oh, hey, Rebecca, how are you? Yep, 2, twosies, doubles. Sherry's got a 2 exclamation points. Now, I mean, so what's cool is now I get to tell you. So the second clinic was our clinic, was my clinic, the clinic that I got to work at. So we did do all those things. Puppy comes in, 6-month-old Pomsky, collapsed in the backyard. And I got to tell you, in Florida, in the summer, puppy collapses in the backyard. First 2 things we're going to think about is anaphylaxis or heat stroke. So puppy presents, temp's normal, temp's okay. So I thought the dog got stung by a bee, or something, and just kind of had a vagal response and dropped. So was treating it for that. And this is, again, 2020, curbside, bananas in the clinic. I'm doing, 10, 20 different things. Great technicians. I give the dog Dex and Benadryl, nothing. So dog does look a little punky. We get a BP on it. BP's low, put a catheter in it, bolus the pup, give some epi, just in case. And so I do that. I'm like, okay, clearly we've done, I'm where I need to be with this case. I go back into treatment. And I start seeing other patients, and the technician that you see there, who is in the, those are not my underpants, by the way, everybody. I mean, sorry about that. Everybody would think like, because of the band, like I was wearing drawers on my head. That's my surgery cap. So but clearly, obviously too, like we're in surgery, so it's probably not anaphylaxis. But that technician, our lead technician, comes up to me in the middle of all this going on. And she says, I need you to stop what you're doing and come back here and reassess this patient. Now, I want everybody to just kind of take in that moment. Think about what it takes for a technician in a clinical environment like that, very busy, lots of cases going on, and technician comes up to the doctor and essentially says, you're wrong, you're missing something. I'm advocating for the patient. I need you to come back here and look. It takes a lot of those things that we talked about, that empowerment, that teamwork, that the mistakes are opportunities for learning. All of that needs to be in place. Anyhow, take the puppy back to X-ray. It took radiographs, loss of serosal detail, slap the ultrasound probe on her, free fluid, tap it, blood. The puppy was, more of the history that I got. Pup was spayed at St. Elsewhere Hospital, about 5 days before that. It was a hemoabdomen, and it was, one of the ligatures had slipped. So took the dog into surgery, got her transfused. Great story. I mean, this is, I get goosebumps every time, like telling this, just looking at everything that had to happen for that puppy to be alive. Now, plot twist. First clinic was me also. I came into that clinic that you see there as a relatively new graduate veterinarian, about 3 years of experience. And I was very my way or the highway, like this is how it's going to be done, and understood through the pain of that experience what the impact of that has on a team. So I'm grateful to say that it's not like that, now. But that's that. I don't know, like we had a great team there clinically when I got there, and we had all the clinical acumen. I don't know if this week, by the way, this is the next day. I don't know if this puppy potentially might have made it in that hospital or in our hospital back then, not because the team wasn't excellent at what they did, because of the psychological safety, this term, that I don't know if I was wrong, if the team potentially would come up and say something because of the climate in the clinic. So these things absolutely affect patient care. They affect patient care. They affect job satisfaction. They affect all these things. And by the way, when Zoe Barnes, sorry, HIPAA, Zoe, I love, she's cute, isn't she? Like, just like dive into that. Like, what a great puppy. She's fantastic. Like, hold the damn trophy, y'all. Like, when this happens, like sit down on the ground, let that puppy kiss you in the face and take a selfie so that you can bring it up and you can kind of enjoy that positive emotion as well. So I just want to say that psychological safety, like that climate, that what we did in our clinic is why that puppy is alive. If I was throwing instruments and all this stuff, I don't know that, I think we've all been in situations like that and we don't feel comfortable, stepping up in those situations. Well, Google, everybody's heard of Google. Google did a study a project called Project Aristotle a few years ago. And Google wanted to know, what is the most important factor in successful teams? How do you make the perfect team? What they found out is, and they thought it was level of education, things that intuitively we might think, level of education, experience, seniority, all of those things, that's what really drove innovation and teamwork. What Google found out is that who is on a team matters less than how the team members interacted with one another, how they structured their work and worked together, and how they viewed each other's contributions, which is this concept of psychological safety. So psychological safety was founded essentially by Dr. Amy Edmundson. She is the founder of modern psychological safety. What she found is that when she did her PhD work, she looked at human hospitals, and they had this team cohesion survey, this team cohesion assessment. And she intuitively thought that nursing teams, medical teams in human hospitals, the teams that had a high level of cohesion would have less medical errors. Seems intuitive, right? Like, we all work together, we work really well, we do that. What she found was, when she assessed all of these teams, sometimes same hospital, same floor, just different teams, when all these teams were looked at, the teams that had the highest level of cohesion had the highest level of reported medical errors. Now, I said something important there. There was one word in that. Throw it in the chat. What was the important word that I said? Crystal nailed it. Yep, right off the bat. So, and many of you, yep, Kate, absolutely, reported. So it was so statistically significant that they went back and reassessed, they re-interviewed, and what they found was what they thought is that the teams had a higher level of reported medical errors that had a high level of cohesion. But when they looked deeper, it was because the other teams feared coming forward with the errors. They didn't want to bring them up, and they actually did make more errors. So obviously, how our teams work together really connects in how we deliver patient care. So McKinsey put out this survey, top 10 or top reasons for quitting previous job. This was a year-long thing. If we look at this concept of psychological health and safety, a little bit different than psychological safety. I know these are wonky, but I won't get into it. But all of these things right here, all of those factors right there are part of this concept. It's what keep us, these things, when we can infuse these into our veterinary workplaces, it makes it sustainable for us. And what we don't want is this. You know, has anybody ever, here, you pull into the clinic, you pull into the hospital, hands on the steering wheel. Okay. All right, I'm going in. That's culture. That's psychological safety. If our teams are having to do that over and over again in the parking lot to just get up the gumption to walk in the door, that's culture. Now, what's interesting about this, kind of the wonky and the connection with fear-free, those of you that are fear-free certified know how the stress response works in our patients. Well, guess what? We're mammals too. We have the same basal parts of our brain. We have that amygdala, we have that reptile part of our brain. And normally we can access this thinking part of our brain, where we can really get into it. But just like our canine patients, our feline patients, our other patients, when we're stressed, we go into emotion, we go into threat mode. And emotions are very powerful. These things are very powerful. They keep us alive. And, to give you an idea why this is also important, this is an average veterinary professional's adrenal gland on any given day. What happens though is we get hit, literally without being over the top, hundreds of times a day. Hey, Mrs. Smith is on the phone. She's really upset. Oof, things like that. Those trigger the threat response. Those trigger our sympathetic nervous system. If we can be intentional about creating environments where we have the psychological safety, where we feel safe amongst others, amongst our team, the threat response decreases. We increase the induction of positive emotions, which increases oxytocin, it increases dopamine, it increases serotonin, all the cool neurotransmitters, and it makes it a better place for us. So little bit more on psychological safety. We're gonna go through how do we know if we have it, and then we're gonna say what do we do if we don't. So we've kind of gotten around this term, but what is psychological safety? So the wonky or Dr. Edmundson's definition, it's a shared belief held by members of a team that the team is safe for interpersonal risk taking. That means I don't feel like I'm going to be judged if I bring up a new idea. I don't feel like I'm going to be judged if I make a mistake, those types of things. So what is just really quick, what is as human beings, what's our most common fear? Just throw it in the chat. Yep, Lauren, failure. It's technically not failure, but that's a good one. Rejection, right? Yep, we're on it. Oh, Nancy, yep. So we're right there. We're right there. Shame, all of these, not being liked by others, inadequate. Everybody's gonna, when I say it, you're all gonna go, oh yeah, because it's all associated with this. Technically, so it's fear of public speaking, right? Like that's, so why do we have a fear of public speaking? All of those things that you guys put in y'all put in the chat. Because why do we have a fear of public speaking? We have a fear of humiliation, and that leads to a fear of isolation. And it's an evolutionary adaptation because back, 10,000 years ago, if we got kicked out of our tribe, we didn't live. We didn't make it. We couldn't survive on our own. We weren't Bear Grylls, getting dumped into the, into the outback. So we have a strong, intuitive need for belonging as human beings and as veterinary professionals. Brene Brown, I think everybody's probably heard of her, wonderful researcher around vulnerability, around all of these concepts. She says, vulnerability is uncertainty, risk, and emotional exposure. It's the birthplace of love, belonging, very important, joy, courage, empathy, and creativity. So what vulnerability leads to is what are called high quality connections. High quality connections in a veterinary hospital are feelings of vitality in the connection, sense of positive regard, and they're felt mutually. And they're about 3 to 5 minutes. They're really important. Well, when we're intuitive, when we really work at creating a sense of belonging in our veterinary hospitals, we create this environment for psychological safety. So what's really fascinating is when we look at belonging, and I have all these great stories that I want to tell, but there was an experiment that was done. And so what it was is they were at this university campus, and they took 3 people and they put them in different fMRIs. That's a functional MRI. They tapped them in, they put these goggles on them. And what they did is they had people in different rooms. So we'll say they had Tom, Susie, and Jeff. So Tom's in one room, Jeff's in another, and Susie's in another. And they can play this virtual game of catch. So Tom throws to Jeff, Jeff throws to Susie, Susie throws back to Jeff, Jeff throws it back to Susie, and Jeff and Susie start throwing the ball back and forth. Well, Tom feels what? Tom feels excluded. When they induced a feeling of exclusion and isolation, the same parts of the brain lit up that are triggered with physical pain. That means is isolation, exclusion hurts. It hurts us. And so this is why it's such a powerful response, especially in the workplace. Now, one of the ways that this can manifest itself is, think about a time when either you or a coworker made a mistake. There are good examples of this, and then there are not so great examples of this. How was it handled? How did it make you feel? We've actually got enough time. Would would somebody be kind, just kind enough to just put a quick précis, a quick rundown of a mistake that was made in hospital while you were at work, and give us a challenging response, usually from a supervisor. And Stacy, while we're waiting for that, can you think of something that's happened with you? And then we'll get to Ann's comment.
I absolutely can think of something that has happened to me. When I was a young baby technician, I gave the wrong amount of medication to a patient.
Yep. Beth has got a similar one. So Ann's got wrong medication, sedated the wrong cat. So I'm gonna virtually say, anybody who's made a medication error with a patient, raise your hand. So I already know everybody's hands went up because we're all human. Now, the difference is everyone raised their hand, right? Right. Because it's so common, because we're not machines. So what does that tell us? Is that in medicine, in human medicine, they're better about this. I'll have to say that. In veterinary medicine, we still have this thought, of this belief that this is the case, that mistakes are bad, that they are unacceptable, where we know. And Crystal, thank you. Yeah, I just wanted to take time to read Crystal's response too. So, and thank you everyone for sharing those, because that brings up a lot of feelings. Is that we've had those examples where we've had a mistake happen, and how it's handled is the fundamental difference in what that clinic culture is, what that clinic's level of psychological safety is. When an error is made, a medical error is usually the one that we always use. Medical error is made, we got two choices. I mean, we can say that's an individual failure and berate that person, or we can say, I believe that you are a good, competent, and kick butt technician, veterinarian. I mean, we all make mistakes because we're human. I want to look at the system that's in place, because we know that humans are fallible. What have we done as leaders? What have we done as a system to account for that? So a lot of places do, like, what do we do? Double calculate drugs. We've got backup systems and, and that kind of thing. Yeah. And Beth, I mean, it is, they do expect us to be there. There's an expectation because of the feelings around the pet, of course. But for us, is what can we do to minimize those? And I would say our human anesthesiologists and surgeons and that, do checklists and all of these types of things. So where I'm going with this is, we don't want to blame the person. We want to look at the system, and we want to say, someone had mentioned, if they were at their home hospital, that might not have happened. That's another thing, is that I don't have the systems in place. I'm not as used to where everything is. And and we were busy or what have you. We want to look at the stress level. We want to look at all of those things. So if we're looking at these as a growth opportunity, that's a place where we want to work. And I just want to say too, is that trust isn't exactly psychological safety. So trust is that I'm going to give others the benefit of the doubt. What psychological safety is that I believe when I go into the practice, the others around me are going to give me the benefit of the doubt. So kind of cool. Oh, sorry, Crystal, and it wouldn't have been. Oh, okay. Gotcha. All right. Thanks for clearing that up. My bad. So how do we know if we have it? So let's we're gonna try to assess psychological safety. Stacy, we're gonna see if Mentimeter wants to work for us here. So if everybody will take out their phones and just take a screenshot. I gotta do that. Doop. Okay. If everybody would just use that QR code, and then it should get you signed in. Good. We got a starting to get some thumbs up. Another thumbs up. Good. Oh, here it comes. Yes. Nice. Nice. Good stuff. Good stuff. All right. Cool. I think it's going to work, Stacy. This is it's super cool when this does work.
I've got it pulled up on my phone. I'm ready to go.
All right. All right. We're just going to give it a minute. Oh, they're blowing. It's beautiful. Beautiful seeing all those multicolored thumbs. Cool, cool, cool. So give it another minute or two. And then I'm going to go to the next slide. So if you didn't have a chance to do it, the how to sign in is, oh, everybody's already doing it. Cool. Did everybody, well, obviously everybody's starting to vote already. So this is super into the, like, this is good information. This is actually Amy Edmundson's assessment of psychological health and safety, or psychological safety, I should say. So these questions are really, really important. So when we look at this gives us an idea. Now, psychological safety isn't technically culture. It's a little wonky, but what I will tell you is if you have strong psychological safety, you're pretty sure you got a really good culture in your clinic. So what we've got, and then if you look at the distribution curves, so if I made a mistake on this team, it's held against me. Big one. That's a big one. So where we're seeing is it's kind of across the board a little bit. So that is important. And, and if we strongly agree that a mistake is made on this team, it's held against me. That's something that we want to try to work on in our hospitals. Members of this team are able to bring up problems and tough issues. Strongly agree. It looks like a lot of people have a good supportive network. Super cool thing is that really I get to do this quite a bit. Most veterinary hospitals, that is strong. So we care about each other. We kind of embrace each other, and a lot of times we can bring up tough stuff. People on this team are sometimes rejected by others for being different, kind of right in the middle. Not uncommon to see that distribution. It's safe to take a risk in this team. So that's, the distribution curve is a little, it's distributed pretty evenly there. Difficult to ask other members of this team for help. Again, that's really great that the majority of that's our lowest score. So I also get to teach skills of resiliency. I wish I had all these listed. The number one factor for resiliency is being able to reach out for help when you need it, by the way. And what do we kind of suck at sometimes? Setting boundaries and asking for help. We're quick to help others, but a lot of times we don't ask for help ourselves. No one on this team would deliberately act in a way that undermines my efforts. Good to see that that's more towards strongly agree. That's where we see some of the toxicity and that kind of thing. And working with members of my team, my unique skills and talents are valued and utilized. Love that that's so high. That's strengths-based leadership. That's really what we want to see in our veterinary hospitals. So cool. All right. So now we're going to go to the psychological safety and performance standards matrix. So there's this matrix that Dr. Edmundson came up with, and it lets us know kind of where our practice is or what our workplace is. So there's the apathy zone. That's where people show up, but they're kind of checked out or they're just not engaged. And what what this look, and I've got it bolded there, is it's self-protection over exertion. This is really not where we want to be. This is a really poor climate to work in. Means we've got low standards. We're not really practicing great medicine. We're not really holding each other accountable. And we're also kind of calling each other out, in publicly. We don't feel like we can make mistakes, that type of thing. Next one is the anxiety zone. I'll say, unfortunately, a decent amount of practices end up being here because by the nature of what we do, usually practices try to have high standards, in how we practice, but we do that. And then sometimes those standards are enforced by authoritarian means, is that we call people out. VUCA, that's really, we're talking about volatility and uncertainty in our practices. And it's really a way that we're not going to be at our best when we're in that zone. The comfort zone. Now, that great place that I told you that I worked, or the practice that I came from, we would vacillate between the learning zone and the comfort zone, which is okay. Like we would, we'd really be leaning into CE and doing a lot of stuff, and then we get busy and we do stuff, and we kind of, not that really our standards got low, but we just got a little more lax, and we would kind of go back between comfort zones. So fun place to work, and sometimes we just, we kind of put the brakes on, on learning for a little bit, which wasn't great, but we also realized that we were doing that and kind of bounced back. Learning zone. So this is where we're really collaborating. There's a high level of collaboration, and this is where we're at with performance. So now we're going to see, hopefully this is going to work. So we'll see just if everybody can let me know if this one was working for you. Oh, well. Stacy, is that one coming up for you? That option?
Still loading for me.
It's wonky. So I'll say, well, I'll give it another minute. But this one's not as important. Not the one that's as critical for us to see as the one before. So just remember, we want to shoot for the learning zone. We want to shoot for where we do have high standards, but we're in a safe place where we feel like we can collaborate, where we feel like we're supported. Hugely, hugely important. Not only with job satisfaction, it's huge issue. So very, very highly correlated with burnout. All these areas where personally I really do a lot of work in and grateful to, but it's the connection between all these things is really important. So what do we do if we don't? What are some of the ways that we can create psychological safety? So just so happens there are a couple different methods, or there's a couple different things that we can look at. Now, this happened to come from Mass General, I believe. This was right around the pandemic. They really leaned into it from a medical point of view, so that's why I included this one in here. So what do they do? What do they feel like were the core areas? Discussing mistakes, frequent updates and feedback. So birds on a wire. It's not like I'm, as a leader or, whomever, whatever our dynamic is, that I'm not talking to you, once, every 6 months, is that we're trying to communicate often. And then at different areas too, is that not just, all areas of the team are talking frequently. Fostering curiosity. So I've got right up here, got the old Walt Whitman quote from Ted Lasso: "Be curious, not judgmental." Hugely impactful in our workplace. Build connections. Remember the high quality connections we talked about. Being vulnerable with one another. Really leaning into being intentional about creating powerful relationships in the workplace. building trust. And we talked about that. So trust also meaning that I give you the benefit of the doubt, and then you give me the benefit of the doubt. And mattering, hugely important, making team members feel valued. So in one way or another, all these things, we can describe them in different ways, but they're all connected. So the group that I'm really lucky to work with in Australia, called the Wellbeing Lab, they're international experts in psychological health and safety. They actually worked with Dr. Edmundson, so it's super cool. They were on a podcast together, Dr. McQuaid and Dr. Edmundson, and they walked through these, and they felt like these were really core areas that we could work on, in workplaces. So conquering incivility, being generous, getting honest, listening appreciatively, and growing from failure. And so I'm going to go through these a little to kind of give us an idea of what this is. So Christine Porath, she's one of the main researchers on incivility in the workplace. Her work demonstrates that 98% of workers experience incivility at work. And what happens is that when we encounter this, time worrying about the incidents, thinking about that squirrel cage, just going, oh, that person, they did this, they did that. It disrupts our ability to pay attention. It impairs our creativity, and it robs us of our productivity. So I did a large survey actually from the Wellbeing Lab, the PERMA Workplace Wellbeing Survey. This was one of the responses that we got from a team member, from a veterinarian, or no, a veterinary support team member. I mean, these, we're talking about how important belonging is and how the physical pain of isolation is there. Just so you know, we were actually able to, even though it was an anonymous survey, we were able to connect with this one particular person and get them some resources to help them out. They're very, very grateful. But yeah, I mean, really, really important. So what's fascinating is civility in medicine. So there's this quote here, but what I'd like to walk you through to give you how important this is they took medical students, and they had medical students on a surgical rotation. Surgical rotation, one attending had a script. That attending was encouraging and kind. The other attending with the other group of medical students was, I think it's funny how they said, was mildly rude and discouraging. Encouraging and kind, mildly rude and discouraging. Stage medical error happens during the rotation. The only difference is how the attendings acted. Encouraging and kind, 82% of those medical students reported the error. Mildly rude and discouraging. This is not yelling, calling somebody out. This is mildly rude and discouraging. Just incivil, 30%. So this is real world stuff when it comes to patient quality of care, impact on patients. And then what happens when these these are traumatic events for everyone. So this is vitally important, in veterinary medicine. So simply increasing the courteous and thoughtful interactions in the workplace can reduce burnout. So hugely impactful. So the next thing is be generous. One of my favorite authors and researchers, and I wouldn't say he was my professor, but he's the youngest tenured professor at Wharton's Business School at Penn, is Adam Grant. And in Adam Grant's book, Give and Take, he talks about there's 3 types of people. They're givers, takers, and matchers. So givers, they build teams, they establish environments, they give in and of themselves. Takers are energy vampires. They're kind of out for themselves. They kind of just take more than they give, obviously. And matchers are kind of transactional. It's like, oh yeah, that's right. You help me do this thing, so I'll help you do this other thing. But I'm kind of keeping score. So generally speaking, three types of people. So what's fascinating is he looked at the medical students from University of Pennsylvania and he ranked them all, or he put them in the different classes. So in the chat, who do you think scored the highest in the class? Which groups, or sorry, lowest? We'll say lowest first. Who do you think was the lowest? Givers, matchers, or takers? Takers, matchers, Lauren, yeah. Matchers, takers, matchers, takers, matchers, yeah. Oh, everyone, the lowest scorers were the givers. Now, who do you think scored the highest? Who, generally speaking, were in the higher ranks of the class, like top 10% of the class? Givers, matchers, or takers? Takers, matchers, takers, givers. All right. Everyone, I'm happy to say it was the givers. Yep, Karina, it was the givers. Now, how in the heck did that happen? And one more thing in the chat. What are we really crappy at setting as veterinary professionals? Bingo, boundaries, setting boundaries. So the difference is that the givers down here, they gave in and of themselves to the detriment of their performance. The givers up here gave, but they gave in a way, there were a couple things that were very impactful. They could spot takers, so they would give in and of themselves, but they would not let themselves get taken in by a take, kind of the, fool me once, shame on you, fool me twice, shame on me. So they spotted takers, and then they were impactful with the time that they used. So they would choose to be of service when they knew that they could be of service in a period of time that they could do something very impactful, but it wouldn't necessarily affect everything else. So they wouldn't give in and of themselves totally that would take away from their performance. So it's important for us to be able to give, but not give too much that it takes away. So again, that's, whew, I mean, that is a lesson. That was made for us, So the next thing is getting honest. So getting honest means having hard, tough, or courageous conversations. It does not mean I'm just going to tell you like it is, because this is a fact that honesty without empathy is cruelty. So I can have a clear conversation with you about things that are going on, but if I do not take into consideration how that's going to impact you, that's not, that's where emotional intelligence, that's where coaching, a lot of these things come in, because just not saying anything about it does not allow us to improve. It doesn't allow us to get better. It doesn't allow us to work through some of these comfortable, these uncomfortable situations. In fact, one of the important things to know is that psychological safety does not mean being nice. It doesn't mean that we never disagree or we don't, get along or anything like that. So just remember that, though, is that for getting honest, honesty without empathy is cruelty. So listening appreciatively, what I would say, there it is keep this one in mind. So I've got a whole thing we can do on coaching with appreciative inquiry or appreciative listening, active listening, if you will. But the core of this is be curious, not judgmental. And then the last one is growing from failure. So a growth mindset. The simple truth about failure is, I mean, sometimes it's bad, sometimes it's good, but it's rarely fun necessarily or straightforward. When we use the term failure, though, it carries a weight that has a psychological impact on us. And there's such a social stigma around it. It has a big effect on us. Now, how do our mindsets show up at work? Now, there's two, I didn't go too much into it, but when we talk about growth mindset, there's a researcher named Carol Dweck, got her book over there called Mindset. But what she found is that there's a fixed mindset and a growth mindset. Now, what a fixed mindset is that essentially it's fear-based. So this is how these show up at work, is that when I'm at work, if I have a fixed mindset, I feel like I need to be impressive. I need to I have to impress you. Also means that deep down, I feel like I'm not really good enough. Sounds like imposter syndrome, right? When I get negative feedback, it wounds me. And that when I fail, it feels fatal. I need to be in control. Anybody ever said, hey, you know what, just step aside. It'd be quicker if I do it myself. Well, welcome to our fixed mindset. I mean, I'm sure none of us have ever done that. Joking. And then the interesting thing is that while that fear is it pushes us. I mean, I'm a, myself, a benefactor of fear-based decisions for a while. It moves us in a direction. I mean, it's not all necessarily bad, but what happens is that our success plateaus because of those things. But if I've got a growth mindset, I feel like with learning and effort, I'll improve. And that when I get negative feedback, it starts saying, what could I do better next time? And not taking it personally. Again, this is a challenge. Failure as a teacher, and that we feel like we need to show up and just be part of the team, and that success grows. And so really fixed mindset is about proving yourself, and growth mindset is about improving yourself. Fixed mindset's about proving yourself. Growth mindset's about improving yourself. So those 5 things, generally speaking, if we're doing all of those things, we probably have a pretty dang good foundation for psychological safety in our practices. So wrapping up, what are some of the take homes? So we said, what is psychological safety? It's the ability for us to take interpersonal risk. How do we know if we have it? We can take now, caveat, I would not recommend just taking, in fact, I will not recommend just having your practice take the assessment, the psychological safety assessment, unless you have a consultant or somebody in there, because it's like running a test, and then if it's bad and we don't know how to work through that. But that is one way, working with a professional, in the realm of psychological safety, is doing that to find out where we're at, taking an assessment, just like we do diagnostics on our patients, and then knowing the interventions to use as a team to work through that. And then what do we do if we don't? Conquer incivility, and we can do those interventions without doing the assessment. Conquering incivility, growing from failure, listening appreciatively, being honest, and be generous.